Engagement with the Global Fund is critical to achieve our goal. The Global Fund invests approximately $4 billion in HIV, TB, and malaria programs. It contributes to leverage domestic resources, and it has political influence in many countries. This year, we have refined our engagement and advocacy strategy with the Global Fund to increase attention to pediatric HIV and TB. And I want to highlight three main areas of work. The first is that countries are on the lead. CCN engagement, but also engagement with communities, participation in technical working groups, and overall engagement with the national dialogue is a game changer. Second, we need to strengthen linkages between national and global advocacy work. This means bringing our evidence and expertise to the Global Fund Secretariat to inform debates and policies. In this regard, documentation, bilateral meetings, communication, among others, are part of our strategy. And finally, our strategy is about working with others. The Global Fund is part of a bigger architecture, and we need to operate within that system, working with technical agencies, global civil society, and the broader health movement to bring impact.
The Public Policy and Advocacy team drives its work at the national, regional, and global levels. Part of our role involves providing support to our country teams to implement national level advocacy, as well as connecting this national level work with regional and global advocacy initiatives. We therefore worked very closely with the Kenya team to develop a clear national advocacy strategy to engage with the Global Fund country coordinating mechanism. Our strategy involved bringing together EGPAF's programmatic expertise and civil society partnership experience to bear on identifying the most critical priorities with regards to pediatric HIV and childhood TB, and then advocating to have this included in the Kenya funding proposal. Bringing the Public Policy and Advocacy team's global and regional experience enhanced our targeted advocacy for pediatric HIV and childhood TB within the Kenya Global Fund funding proposal.
So welcome, Gladys, and thank you so much for making the time to do this short video this afternoon for the purpose of our training curriculum. Can you let us know why was it important for EGPAF Kenya to engage with the Global Fund?
Yeah, so when we began the year in January, we had already begun having conversations on what we'll be advocating for as a country. And we had come up with some priorities in terms of advocacy. What came out very strongly for us was that, we needed to have sustainable funding as a Kenya program. And that was basically, coming from the point of we had a lot of projects that had ended the year before, and, our major projects were also coming to an end in a year or two. And we thought, okay, where is a good place to think about sustainable funding? And Global Fund was just, it was right on the money because, Kenya was just going to begin having conversations on the application process. And so we thought, why don't we use this platform to talk about, issues affecting children and how we can get more funding around, pediatric issues for children. And that's how the process really began. So I think what we had thought about was throughout the process as a program, we're going to look at, evidence, and we're going to look at our evidence, and we're going to put in our expertise as, as the leaders in pediatric and HIV and TB, and then just try and use that information in the global application development process and just run with it from there.
Why civil society? Why did EGPAF decide to work intensively with civil society organizations in Kenya for the purpose of advocacy with the Global Fund?
Yeah, so civil society. So in Kenya, the civil society, especially around HIV, is a very strong network. They have a very big voice. They have a lot of backing from not only donors, but even from the Kenya government. And as a voice, they are the best people, especially for a process like Global Fund, because Global Fund in itself, they put a lot of weight in listening to the CSO's voice, because the CSOs represent basically that the voice of the people living with HIV, workers and anybody else who's involved at the grassroots for the HIV process. And for Global Fund, they like listening to the CSOs because they get the perspective from the ground. And so for us, we needed to get in touch with them because, I mean, these are the people who understand the issues that we are facing. Some of them are people living with HIV. Some of them have children who are living with HIV, and so they understand the issues that are there. And beyond that, they also had already begun noticing that in the past cycle, that the issues on children were not really being presented in the application. But beyond that, they were like, okay, we know they kind of knew there was a problem, but they did not know how to articulate it. So that's where now EGPAF comes in, because we now give them the voice, we give them the information that they can use to articulate. Yeah.
Thank you. Can you describe the process? We firstly congratulate you that you managed to achieve the culmination of your efforts was a pediatric charter that was authored by the CSOs that articulated what the collective voice of Kenya civil society organizations is demanding from the Global Fund, and also putting in place is accountability mechanisms for a smooth implementation of the grant. Can you describe to us the process that happened from the time EGPAF Kenya purposed to work with CSOs leading up to the successful submission of the grant, and your role in this?
Okay. So once we identified, I'm sorry, can you hear me? Mm-hmm. Okay. All right. I got my internet was telling me it's unstable. Right. But okay, so once we identified that Global Fund is a good place to begin, to begin thinking about funding and so on, and just being a platform for us to use to advocate on pediatric HIV and TB issues. The first thing we did was create a task team. In Kenya, we call them committees, but basically a small group of people who will be, our think tank of how are we going to go through this whole process. So in that think tank, we had our country director, we had our director of programs, we had representatives from the TB program, pediatric, and our leads in pediatric HIV and adolescent HIV. And once that team was formed, the next thing we needed to analyze was the evidence. What are we saying? We're saying that there are issues. What are these issues? So this team was the one that came together, synthesized data, looking at where are we, what's the information in Kenya, what are we seeing as EGPAF to be the issues. And then once the team came together, the next thing we thought about was, okay, we have all this information. Let's put it together in a way that, let's put them into assets, for example, documentation, products that, that can be used during the process. And so the next thing was we came up with, from that information, we developed what we call key messages and advocacy asks. So we said, when we go through this process, we are going to be, these are the two items we're going to be saying. We're going to be having these key messages that we're going to be using wherever you are, whichever meeting you're in. These are the things you're going to be talking about. And, then from there, we said, okay, great. We have all this information. We have this very important group called the civil society organizations. How can we then engage them? Because they're the people who are going to be our voice in those meetings. And so we then thought about convening a meeting, which we called the dialogue meeting on children. And this meeting was co-convened with Lean on Me. Lean on Me is a CSO that's also, they also do a lot of HIV work. But in particular, this was special for us because the founder of the organization is also an EGPAF ambassador. And she's also in the Global Fund, board. And so she was able to give us a lot of interesting information. I mean, she was giving us a lot of intelligence on what we need to do as we go along the process. So once we had all this information in place, we had a 4-day dialogue. And in those meetings, we were basically sharing as EGPAF what is the evidence that we've had around pediatric TB and HIV. What are the achievements? What are the gaps? Where do we see global fund coming in to fill in those gaps? And then, so this happened over 4 days. So that is what we did. But we also, because it's a dialogue, we also asked the CSOs to tell us, what are you seeing on the ground? What are you seeing to be the issues for children? How do we then begin having this conversation? How do you ensure that as you people go through the meetings, because you know the Global Fund process is a series of meetings and dialogues and negotiations. So as that went along, the CSOs also told us this is what we need to do. So by the time we were getting to day 3, we were kind of in a place where we had identified these are the issues that need to be discussed, and these are the things that need to be included in the application process. And by the time now we got to that place, the next thing was, okay, so we know what the issues are, we know what we need to discuss. Can you give us a document so that when we are in these meetings and we're having these discussions, then the next thing we need to do is what are we referring to when we are telling people, for example, there's a gap in pediatric HIV. And that is really how the charter came to being. So the charter then became the reference document. Anyone who was talking about pediatric HIV or pediatric TB would refer to that document throughout the process. Yeah, and so I think now once that was done, we had to also just ensure that we were constantly, following up because, it's a series of meetings that go over months. And so we also then ensured that we have our technical leads and our technical advisors because they sit, initially they were already sitting in specific technical working groups within NASCOP, which is our HIV the government, it's our government HIV response entity. And so we needed to ensure that even our EGPAF staff who are involved in, the technical working groups and the different committees, and even in those different dialogues, that they also have this document that they're using to talk about the issues that we have talked about. So I think all that, and then on top of that, we also had the PPA team. So we had a lot of support from David and Rhoda, I think yourself, just walking us through what is Global Fund, how does the process work, what do we need to be keeping an eye on. So all those things came together and just helped us, to just unify our conversation during the process.